Hi, friends. Welcome to Coffee with Ravi. This is a post to kick us off into 2025. One of the topics that is top of the mind for us, or for me, and for a patient, our patient population as a whole, is how to lose weight. And as I started thinking about it, I thought I'd do a short post, but then I realized that it's a complex topic. But I wanted to give you just kind of the 1,000 foot level. Right after the holidays, we accumulate some holiday weight gain. There's a lot of medical issues that go with it, and not to mention the psychological, social aspects and how we look at our own selves. So it's a very complex topic, but I wanted to sketch the broad outlines. From a standpoint of a medical perspective, obviously weight gain has been tied to the metabolic disease pathway and the cancer pathway, among other things. When I talk about metabolic diseases, I mean things like diabetes, hypertension, etc., that obesity or gaining weight is associated with, and how that then leads to a risk of heart disease or myocardial infarction or a heart attack, and the risk of a stroke. And then there's a separate pathway that we are now realizing that as we gain weight, there's a lot of other complications that go down the cancer pathway. There's some miscellaneous issues too. There's a risk of pulmonary disease in terms of asthma, sleep apnea becoming worse, osteoarthritis becoming worse. There's some reproductive abnormalities that can be associated with it. Severe pancreatitis is associated with it. Gout is associated with it. So a lot of other miscellaneous diseases associated with it, and cancer risk has gone up too. I have a slide up here that goes through the cancers that are associated with weight and obesity, including cancers of the esophagus, cancers of the endometrium, ovary. There's a increased risk of liver cancer, gallbladder cancer. So a number of cancers that have been associated with obesity and weight gain. So the case for losing weight, other than of course feeling better and actually from a medical standpoint, is to prevent all of that. Typically the weight that is needed to be lost is in the range of 10%. So if one is, let's say, 170 or 180 or 200 pounds and wants to lose 10%, that's about 20 pounds. That 20 pounds weight loss can be tough, and an average goal, which I tell patients, can be about a half a pound a week. If we shoot too high, several things happen. We either can't do it, or it's impractical, or we give up, or if you lose too fast, you then have a risk of losing muscle as well. So all of those need to be balanced into that goal. So a goal of about half a pound a week can sometimes be practical. So what are current options? There's a whole host of medical managed options that are coming up, including the GLPs, which is the Ozempic, Wegovy, that category of drugs. There is the other appetite suppressant pathway, which include drugs such as phentermine. There is endoscopic options that we've touched on, which is endoscopic sleeve gastroplasty, where we can reduce the size of the stomach. So more to come. We're gearing up to do that for a select group of our patients that have significant obesity. Bariatric surgery can be sometimes an option if the endoscopic option is not viable in one's case. Bariatric surgery can sometimes be considered, but there's a whole host of it. But what I wanted to kind of share with you, which are general applicable principles, are that a great majority of weight loss can be looked at through diet. From a diet standpoint, if you look at the energy that we're taking in, because food is energy, a basic concept is that we are trying to balance, or actually we're trying to be in a negative. In other words, we are trying to take in less energy in the form of food than we are required to keep the body going, as well as our activities. So in other words, if what we are taking in is less than what we are needing to maintain the functions of the body and exercise and daily living activities, I think that negative energy balance is what we need to look at. The problem with this is that we don't know what this is. In other words, how much energy is needed to maintain the body, how much energy is needed for us just doing our activities of daily living, which include bathing, eating, moving around, or what our jobs entail. And the third aspect we don't know is how much are we expending through exercise if you're doing some exercise. So really where it comes down to is that detail and knowledge of that detail, and I want to talk about that very briefly. From a standpoint of the energy balance yet, within that, a Mediterranean diet seems helpful, which is a diet that is plant-based, that's got some grains in it, that's got a total fiber content of about 25 grams at least at the bare minimum to contain and fiber helps in a number of ways, and some degree of restricting the carbs in the diet. So it's within the context though of this energy balance. The other thing to remember is we think that exercise is going to lead to some weight loss. Yes, exercise can contribute, but exercise by the relative contribution is only about 20%. The majority of it is going to come through this energy balance in the diet. Any exercise, of course, is better than no exercise, but within the exercise component of it, if we can try to get to about 80% and aspire for an 80% heart rate, and there are various recommendations that are out there in terms of what's moderately active exercise, what's exercise to the level of 80%, and how many minutes per week. And there's recommendations that if you get about 150 minutes of moderately active exercise, but then the question is, how are we defining this moderate? What's the heart rate that we are trying to get to? And so the real important thing to realize is if you're trying, do as much as you can. There's really, at the very least, if we are doing about 50%, if you're able to get to 150 minutes, that's fine. And within that 150 minutes, can you get to about 80% of your maximum heart rate, which is really your age your 220 minus your age. That gives you a sense of the maximum heart rate. And within that maximum heart rate, are we able to hit at least 80% for a good portion of that 150 minutes? Stepping back, the context is that that's an adjunct, but a great majority of it will be through looking at this energy balance. And that's so easily said, but we are so habituated to what we're eating. And the second piece is we just don't know how to calculate the total calorie content of what we're eating. Nowadays, many tools are available. We could look at MyFitnessPal or any other apps that can tell you if you can measure and standardize your diet so that we're not eating a whole variety of it, at least for a period of time. You will have a sense if you do a dietary log and then use apps such as MyFitnessPal or look at the internet, you will get a sense of total calories you're taking in, total carbs you're taking in, total fat that you're taking in, total protein that you're taking in. But the number that matters is the energy balance. So that way you can calculate how much you're taking in. Then the other side of the equation is what is your body needing to maintain its functions? How much is exercise expending? And how much energy are we expending doing our activities of daily living? So there are a number of ways to do that. There are equations that are available that can get you on the internet, which is what's called the Mifflin equation or Harris-Benedict equation. And then essentially, if you look up and plug in your weight in pounds, it'll give you a general sense of this is what you require for your basal. On top of that, if you multiply that by about 1.1, you get to what you would need for a sort of a regular level of activity kind of job, plus what you need for activities of daily living. And on top of that, if you add exercise, you get this side of the equation. So it's like a bank account, right? This is what you're taking in, and this is what you're expending, and you will get a rough sense. Now, if you want to get more nuanced about it, there's even better ways to measure the body metabolism, which include lab testing. These are not widely available, but with some perseverance, you could get to it. If you're that motivated about really knowing how nuanced it is and how exact it is, because from this calculated to what it actually is, there can be some variation. But this is reasonably accurate to about 80% or 90% accuracy. So you get a general sense. If you do even this much of matching what your energy intake is and what your energy output is in a sophisticated way, not even a sophisticated way, a detailed way, we've gotten somewhere already. The other nuance to the metabolic aspect is that we'll have to make sure that the body's metabolism itself is fine. Is the thyroid working okay? Our body metabolism is dependent on how much muscle we have, how much body fat we have, and what the relative proportions of that. So there's a lot of nuances on what this number is, but we also need to make sure medically nothing bad is going on, especially the thyroid and other metabolic factors. Are there medications that we are taking in that can interfere with it? So a little bit of a discussion with your health provider to say, hey, any medical conditions that are slowing my metabolism, any medications that I'm taking that I need to look at, and you have assessed your metabolic capacity, and therefore then you have to look at the exercise bucket, you're looking at the energy intake bucket. And of course then there are these other options that are the safety net in terms of medical options for obesity that we touched on, that we can touch on further in future posts. So I wanted to give you just kind of a 1,000-foot view. Obviously this is a highly nuanced, very emotional and difficult topic, primarily because of lack of awareness, and then we have to then also have the patience to work with ourselves. So good luck on all of this. If you have further questions on this, please don't hesitate to reach out, either through our Facebook or internet or on our webpage, etc. I look forward to interacting with you in the future months.